To tackle the COVID-19 crisis, researchers at the Durgapur-based CSIR's Central Mechanical Engineering Research Institute, or CMERI, have developed an indigenous ventilator. This new ventilator meets all the requirements and costs around 80,000 to 90,000 rupees. The ventilator has undergone multiple technical and design changes as per the feedback received from the healthcare professionals of the Health World Hospital and Vivekananda Hospital of Durgapur. The institute aims to further upgrade the ventilator by harnessing artificial intelligence technology to automate the functioning of this mechanical ventilator. As the virus affects the respiratory system, the ventilators are the need of the hour. Let's hear more about this ventilator from Dr. Harish Hirani, Director, CSIR CMERI.
We have developed a mechanical ventilator using motorized bellow. Now, I'm using the word bellow is because it can compress the gas which can contain normal air, or it can contain some percentage of oxygen or 100% oxygen. Depends on the requirement of a patient. What we have developed this is what we are using the word as a basic model, especially for makeshift hospitals. Now there are a number of hospitals getting erected at the different places, but they don't have a ventilator. So this is a basic model which is really required only for adult person. It is cannot be used for the children, and we know very well COVID is more for the adults, not for the children. That's why we have made especially for that, and it's a low cost. We are keeping them it's a lesser than 1,80,000 to 90,000 final selling price. And what we have mentioned done in this, we have kept essential items. What are the essential items? There should be a compression of the gas as per the desirable limit. It should vary also the breathing rate point of view, that be breathing per minute, how many, it can be 12, it can be 15, it can be 18, it can be 30 also. So these are the two important parameters. One is the volume, one is the breathing rate. Both can be adjusted in this. Then we have number of safety features. Now, what are the safety features? But it should not go beyond one certain pressure. That's what we call a PIP. And similarly, it should not go below one certain limit, pressure limit. That's called a PEEP. So both the sensors have been engaged in that, which keep giving information. And whenever these limits are crossed, they give the alarm also. So this alarm is being rectified, or maybe a suitable action is being taken by the clinician who is nearby. So this ventilator is essentially a support system for the patient as well as for the clinician. But in makeshift, there may be possibility there's no light. So we have kept a power supply unit. In this case, we have given a backup plan.